What matters to you?
What matters to you?
What matters to you?
What matters to you?
I'm proud of the work we're doing together as the McLeod River Primary Care Network and Life Medical Clinic, because it's starting to mend some of the social gaps that exist, and we can't consider people just as a medical situation that comes into the clinic. Their life is so much more than their medical condition. It's everything else that affects them in their life, and that affects their health as well.
Well, some of the people are having problems with the doctors not spending enough time. You know, I talked to a lady the other day. Came to the doctor and she said, I told him what I wanted to talk about. There was something else I wanted to talk about, but he was holding the door open and we got to go. In the doctor's office, you have to have a more personal effect on people. Because if it's not, you come in here, you're tense, you're worried about what you're going to say. And I think it's very important to get, hey, like that Dr. Joseph. I said, hey, bring your kids, come out to my place. And he did. So now, you know what? It made me feel better. I felt more comfortable with him. I don't say they have to do that to all the patients, but it's just an example that if you more personally you're going to be with your family doctor, the better results you're going to have.
With the RIFS project, the reducing the impact of financial strain, we had already been really heavily involved with AMA and some other provincial projects, and when RIFS, the proposal came along, it was just a natural transition off of work we had already done with PACT, which was patients collaborating with teams. Our PACT work was faced around how do we be proactive? How do we capture those patients before their health conditions escalate to a point where we know their name and we're very familiar with them? So we found that females ages 18 to 35 and 50 to 69 with mental health conditions such as bipolar, depression, anxiety, and schizophrenia were utilizing healthcare resources, that's the emergency department, inpatient visits, and clinic visits, more than chronic disease patients, those such as diabetes, hypertension, asthma, and COPD combined, up to 4 times as much. So as we were coming to the end of our PACT work, we were reaching out to that population a bit more, but we're like, we really need kind of a tool, because it's not everybody in that population, and that's where the RIFS work just jump-started from there. If we're going to be making a tool, implementing it, and tracking it, let's see what other value we can get from it. And so we developed our current tool, which has 6 questions, and it identifies a few areas of strain that there could be that are tied to financial strain. So it asks about financial strain. Do you have difficulty making ends meet? It asks about your ability to afford medications. It asks about, do you have trouble finding transportation to your appointments? And then it talks about your housing. Is it stable? Is it unstable? What's that look like? And then it asks about your social strain, and then social supports. So are you lonely? Are you isolated? And then we thought, okay, this would give us a good start to start digging deep and finding out what's going on underneath.
When we started, we worked collaboratively with the PCN social worker. We have Tara, we have Roberta, and there's a referral process. We have a form that we just complete and we send it off to them. Immediately, I think the system was overwhelmed because there were just too many. So we started looking at in-house, improving in-house capacity. So training our medical office assistant to actually be able to navigate patients. That was one of the things we did. So they have the resources actually on a key ring. Okay, you need to see mental health, we can navigate, or we can make a call for you, we can refer you, and you need to see someone in employment, we can do that for you, or this number you need to call. So our assistants know how to do that. In addition to that, we've had discussions with some of the doctors in our community on highlighting the resources that are available out there so that doctors themselves can actually navigate patients without necessarily referring them. So that has eased the burden on the PCN resources.
some people's ideas about what is financial strain are quite different from what other people's ideas are what financial strain is. So just really recognizing that it's a spectrum, and ensuring that regardless of people's concerns or what they're struggling with at the time, is that, you know, that if we don't know what resources are, we're going to find them, we're going to access, and definitely removing those silos. And from my experiences, anytime anybody works together collaboratively, things move faster. So I think as a support worker, the role within RIFs was to help navigate that. And sometimes it was just piece by piece, or day by day, or task by task, or goal by goal, and not trying to do everything all at once.
I think it's great to just be giving our patients an opportunity to talk about this. I find that, like, as a mother, you know, you got to stay strong, or, you know, you don't want to say I need help. So I think with this, just having an open conversation and just having us start it, you know, like, anything we can do to help you, let us know. And it does. And I feel like then people feel like, hey, yeah, like, this is actually something I can talk to my doctor about. It's not something you have to do on your own. But I think just giving them an opportunity to say, I need help, is a great thing.
I don't see it as a project. I see it as a mental model that we should promote all over the country. An environment where, you know, teamwork is, you know, encouraged. Thinking is promoted. You know, ego is, you know, suppressed, and you know, innovation is, you know, encouraged all the time. This kind of thing will thrive.